Good afternoon, everyone. It is Thursday, October 3rd. This is the Senate Finance Committee. I'm Pam Vital, along with my Vice Chair, Senator Antonio Hayes, and we are going to vote voting list number 27. So, Nathan, would you like to start with House Bill 905?
Absolutely. So House Bill 905 is the bill related to clinical staffing plans in hospitals. So the bill is back again before you, reflecting some suggestions made at the voting session yesterday. So as amended and shown in the reprint, House Bill 905 requires the Maryland Healthcare Commission, in collaboration with the Hospital Association, to conduct a study related to hospital clinical staffing in the state. And so the study must include a review of existing laws, accreditation standards, and regulatory requirements, a catalog of policies implemented by hospitals to date, and a summary of best practices for clinical staffing and shared governance in hospital operations. The Commission and the Association must consult specified stakeholders. The list is the same. And the report must be submitted by October 1 of 2026. The Healthcare Commission has indicated that they are fine to conduct the study.
Okay. Thank you, Senator Gall, and Senator Hayes seconded. All in favor of House Bill 905 with amendments? Do we have it?
Yeah.
I know, you're recusing yourself. 905 with amendments? All right, I think we need to call the roll.
House Bill 905 favorable with amendment. Vice Chair Hayes?
Yes.
Yes. Senator Kramer?
Yes.
Yes. Senator Reedy?
No.
No. Senator Mounts?
No.
No. Senator Jackson abstain. Senator Washington?
Yes.
Yes. Senator Guile?
Yes.
Yes. Senator Lamb?
Yes.
Yes. Senator Hershey?
No.
No. Madam Chair?
Yes.
Yes. 6-3, the bill passes.
6-3, the bill passes. Thank you.
The next bill on the list is the cross-file Senate Bill 720. A motion favorable with amendment to conform to the bill that you just voted on would be appropriate.
So move.
Second.
Okay, should we use the same vote or call the roll again? Use the same vote? Pardon me? Same vote. Same vote on Senate Bill 720. Thank you.
So the next bill on the list is Senate Bill 696. This is the chair's bill that deals with pediatric hospital overstay patients. It was held from yesterday for purposes of an amendment. I'm going to walk you briefly through the reprint. So I will say, though, about the amendment language that's offered by Senator Hayes on page 3 that I'll discuss specifically. This is the product of conversations between the Department of Health and the Department of Human Services. And so they reached an agreement yesterday. The Hospital Association, which is also heavily involved in the work on this bill, is also fine with the language. So starting on page 3, you can see up at the top below line 4, the first indication that instead of establishing one coordinator for pediatric hospital overstay in the Governor's Office for Children, there are going to be 2 coordinators, one in the Department of Health and another in the Department of Human Services. Further down the page, after line 12, is the amendment that's offered by Senator Hayes. So whereas before, the language of the bill was that the Department of Health, in coordination with the Department of Human Services, was required to ensure that a patient was transferred and treated in the least restrictive setting possible. Now, the Department of Health is generally required to ensure the pediatric hospital overstay patient is transferred and treated in the least restrictive setting possible when clinically indicated and when possible. And then separately, the Department of Human Services is going to coordinate with the Department of Health specifically for overstay patients who are children committed to the care and custody of the Department of Human Services. So these 2 parallel provisions sort of help suss out the responsibilities of the 2 departments. Further down the page, you can see the specific provisions related to the 2 separate coordinators beginning below line 17. Moving along on the next unnumbered page are provisions that would have established a mandated appropriation. That is struck on page 4 of 6. Provisions related to the coordinator in the Governor's Office of Children are struck. And then finally, there are provisions that would have established a Department of Health study are removed from the bill, and a new work group on children in unlicensed settings and pediatric overstay is established. That study lists the appropriate members of the work group. There's a requirement that the group meet before August 1st, 2025, and at least once every 30 days after. The State Council on Child Abuse and Neglect is to provide staff to the work group. They have agreed to do so enthusiastically. And the work group has several reporting requirements that are outlined here. Finally, the uncodified Section 3 authorizes the governor to include funding in the budget related to 5 additional beds at the Regional Institute for Children in Montgomery County. And the governor's office is taking the lead on securing the funding for those 5 additional beds. And that's it.
Senator Hayes.
Thank you, Madam Chair. Madam Chair, I just want to thank you for giving me an opportunity to work on this a little bit with the agencies.
Okay. Senator
Okay,
Hayes.
well, again, thank you, Madam Chair, for allowing me a little bit more time to work on this bill with the agencies. You know, this is a really, really good bill to make sure that young people that are in their appropriate kind of place and getting the help that they need. The amendment that we propose is really just making sure that young people that don't have to be exposed to the child welfare system are not. And so I think we made a good bill even better in our efforts. And so I just wanted to thank you and move Senate Bill 696 favorable as amended.
Okay, Senator Hayes, Senator Dial. All in favor of Senate Bill 696 as amended? Unanimous vote. Can I ask, same vote for House Bill 962? Yep. Can we? Okay. All right.
Very good.
So we will send that over to the House with our amendment. Thank you for working on that, Senator Hayes.
Up next on the list is House Bill 783. This bill expands the scope of required training for individuals licensed or certified by a health occupations board to include implicit bias and structural racism training. So applicants for renewal of a license or certificate must attest to completion of an improved implicit bias and structural racism training program the first time they renew after April 1st, 2026. The Cultural Linguistic Healthcare Professional Competency Program, in coordination with the Office of Minority Health and Health Disparities, must identify and approve implicit bias and structural racism training programs. Each health occupations board is authorized to adopt regulations allowing for an applicant for renewal to receive continuing education credits for completing an implicit bias and structural racism training program. There are no amendments on the House bill.
Okay. Can I have a motion for House Bill 783? Favorable. Senator Lamb, please do.
So I was just looking at this bill and I guess a background question, because I think a couple years ago we had passed something into statute requiring implicit bias training, and that's required of all licensed providers, not just physicians, but nurses, social workers, and everyone else. And I remember taking it myself, and a lot of that also touched on structural racism. We had to do that at least once before all licensed healthcare workers were required to do that before they got relicensed. So I did that like last year. With this now passing, would I have to do it again?
So the implicit bias training requirement was added to law in 2021, and it was an applicant needed to complete that training by April 1st of 2022. This requirement is related to the structural racism component. And so there is nothing in the law that says that it could not be one combined course, but for individuals who have already completed the implicit bias course, there would be additional training required in order to meet the requirements that this bill places into law. So it would need to be another class in order to satisfy the structural racism requirement. And so it's my understanding that a class has already been created. I believe Senator
No,
Gileman.
but
Sorry?
I was answering the vice chair's question.
Oh.
But go ahead.
And so my understanding is that the class has already been created, and it just needs to be designated and approved, and my understanding is that it can be offered for free.
So,
Like 6 to 8 hours is what I've heard.
right, but so if we went through it before, it's because I remember going through this training, it was long. It included things on structural racism,
Yeah.
and now we have to go through it again? Like all licensed providers have to go through it again?
I don't see a provision in the bill that would make a course that was approved for implicit bias retroactively satisfying the structural racism component.
So I guess the answer to that question is yes. Everyone that went through it before, all licensed healthcare providers that went through before have to go through it all over again.
Another class that is related to structural racism.
Because some people had to pay for that class initially. Like some places like MedCon offered it for free, but like not everyone did. And some
my
people actually had to
understanding
pay
is that
for this like 8-hour-long class.
Yes, so section 3 of the bill on the last page specifies it's the intent of the General Assembly that the structural racism training required under this act be developed and offered using funding from the grant provided to the Maryland Nurses Association from the American Nurses Association to advance anti-racism efforts.
Is this just for nursing?
No, it's for all health occupations,
The bill is for all health occupations.
which
but-
we already all had to take it at least once to get relicensed. And there's no provision to like grandfather us in if we already took like an implicit bias course. Because I remember it touching on structural racism when I spent the 8 hours going through this course the first time. Unfortunately, I was able to do it for free, but I know some people, some other providers had to pay for this. And so you're saying this language here at the end says that, I recognize this language because it's the same language we had for the Hospital Association on the safe staffing bill. It's the intent of the General Assembly that a private entity, which is the Maryland Nurses Association in this instance, have to offer this?
I believe that it's already been, that process is already underway.
Then why does it need to be in the bill?
I don't know, it was amended in by the House.
It's just that similar kind of weird language that we saw about it's the intent of the General Assembly to compel a private entity to do something.
This isn't a private. Senator, this isn't a private entity. This is people licensed under the state regulation.
He's referring to the Maryland Nurses Association.
There's
the
uncodified language at the end.
compelling the, right, right.
Madam Chair, can we add an amendment that there be a test at the conclusion, just to make sure that our health professionals are paying attention?
I was paying attention for the record. All 8 hours of it.
Let's add a test.
It just seems odd to me that like we would compel all of our healthcare workers who are seeking license, not just physicians, but nurses, social workers, audiologists, you know, everyone, counselors, have to go through this again. Sometimes at their own expense. They went through the first time. They just went through a couple years ago.
Can my vice chair have the floor for a minute, please?
Yeah. I get what you're saying, Senator, but I don't think that, I mean, do you think there's some harm in a refresher or at least providing an opportunity for individuals that may not have taken it since then? I think we could probably have a conversation with the agency, but I think the more people are informed and educated about, you know, some of the risk that this provides, especially in a profession that's, you know, as I described last time, so intimate and so involved in folks' lives, I think the better educated, the more informed that individuals are, they provide a better quality of care. Isn't that so?
Yeah, I mean, I don't disagree. Like, having folks more educated certainly helps. I think it's just the burden that it's placing on all healthcare workers not just physicians, but all across the board that need to get relicensed, have to spend a significant amount of time going through this again. We already have an issue with, adequate number of healthcare workers, staffing at facilities and institutions, ED wait times. You're taking, providers all across the board offline for another 6 to 8 hours to do training that in many ways, was included in prior training. It would be something that it would just make sense to grandfather them out.
Yeah, I would just say that the adverse of that, like not having the benefit of having this training and the individual have implicit bias inflicted upon them, right? Like that damage is probably, far more reaching than, inconveniencing a health professional for, and I don't know if it's 6 to 8 hours, I'm just throwing it out there, because my good senator friend shared that with us. Do we know how long the training is? Yeah, I'm not sure. I'm sure we could find out, but having additional training, having additional education, I think is good.
I mean, I don't disagree that the additional training would help. It's just that it's a lot of time. And, the first time we did this, there was a reason it was only done as a one-time. It wasn't a recurring thing. I'm not sure that having someone go through another, 6, 8 hour implicit bias training a second time a couple years later is going to make anyone less biased. Like, I think if somebody's really biased, like, they're going to have problems, The first time is helpful. The second time, I'm not sure you're going to get that much more value added.
Can I go to Senator Hershey and then Senator Jackson?
Thank you, Madam Chair. I think along the lines of Senator Lamb's questions, a lot of times we find a way to get out of fiscal notes by saying that we're getting funding from somewhere else. And this funding is provided to the Maryland Nurses Association from the American Nurses Association. Yet it doesn't talk about, it just says it's our intent that happens. I don't know that there's any guarantees that happens. I don't know if there's
I can provide more specific information
the
there.
specific amount. Is it recurring year after year after year? I mean, if you're saying, is what you're saying is accurate and you have to take this more than once or for every, new individual that comes, do we know that this grant is going to be available for the end of time?
So the information that I have is that the American Nurses Association has invested, this uses the phrase, hundreds of thousands of dollars in initiatives aimed at dismantling racism in nursing. In 2024, the Maryland Nurses Association was selected as one of 12 state nursing associations nationwide to receive a grant dedicated to advancing anti-racism efforts. MNA is committed to addressing systemic racism in nursing and the broader healthcare profession. MNA has partnered with the University of Maryland School of Nursing in the development of a web-based training program based on systemic racism. This initiative is funded by the ANA grant and will be made available at no cost to healthcare professionals and organizations across the state.
Okay, so that tells me that hundreds of thousands of dollars are being divided by 12 different states, is what you said.
My understanding is that the training is funded by the grant and will be made available at no cost to healthcare professionals. Because it's web-based, I think that it's infinitely repeatable and is relatively minimal cost to go from year to year.
And as far as the Department of Health's role in this is just that it needs to be approved by the Cultural and Logistics Healthcare Professionals Competency Program. Is that an entity within the Department of Health, or this is again on Section 2 of, I mean, I guess I would imagine we would want to have some oversight of the content of the program. We don't, I mean, not that I don't trust the American Nurses Association, but
Right.
somebody in the state of Maryland should have some type of approval over what's
And that is the case.
content.
The Cultural and Linguistic Healthcare Professional Competency Program, in coordination with the Office of Minority Health and Health Disparities, is required to identify and improve the implicit bias and structural racism training programs. So this program would fall under their duty to approve. identify and approve. So it would be identified and approved by the office that is already doing this with respect to implicit bias, and the structural racism training program is already funded and paid for by a grant and will be offered for free. It's the information that I have available to me.
Okay, well, again, it's, I think, nice that the Maryland Nurses Association says that. I don't know that we are in any way binding them into doing that. I would assume that if they don't provide us money, that we don't provide the program.
I think that there's a little bit more nuance to the structure, which is that they've received the money and then they are creating the program, and then the duty of the state entities is to approve, identify and approve those programs. So it's not that the association is providing money to the state.
Okay. All right, thank you.
Senator Jackson?
Thank you, Madam Chair. Is it possible that this training could be done virtually?
That is the program that is
virtual?
contemplated as an online, web-based.
And so you're saying that that's too much time? I mean, like,
A lot of time you have all licensed healthcare workers in the state have to go through this again if they've already done it, right? There's no
well,
grandfather.
we have to go through sexual harassment training every year.
And boy, does it take time.
I mean, you know.
But I have training I have to do quarterly for one of the boards I'm on. And it's got federal regulations, and every quarter I spend a few hours in training. I think it's just, but it's virtual, and I can do it when I'm available, and I can stop in the middle and go back. I think virtual training helps a lot versus having to go into a classroom and learn. So, I mean, I think it's just typical of today to try to keep up with regulations. It's not unusual. Senator Jackson, did you have something else?
Nope, I'm good.
Senator Reed?
Real quick on this. So if somebody, these are people who already have an occupational license. This is not a barrier to licensure. Not that it would be a barrier, but you'd have to, you just, okay, all right. Because I was gonna say,
That's the purpose of requiring applicants
for renewal of a license. It's interesting with nursing too, because there's been a lot of problems with, I mean, it's gotten better, but I don't know, we have a provider shortage in the state, so I'm not sure about adding lots more requirements, but.
And Senator, we also have an issue, particularly with maternal health with women of color having higher mortality rates, and part of it is, they think is the care they receive. So I'm in favor of this, but we need to make a decision, either vote it or hold it, move on. Senator Land?
Yeah, I mean, I'm in favor of training, but I'm just not sure that, training 2 years later from when someone did it is going to, on implicit bias, is going to be that much different than what they had before. It's one thing if it's on, substance use, right? There may be new modalities that pertain to substance use. There's probably nothing earth-shattering that's going on in the implicit bias structural racism world. It's important maybe in some ways to have a reminder periodically, but it's not, if somebody just went through this, and it's, when we set the policy a couple years ago, it wasn't set on a recurring, right? So it was set as a one-time thing to let them do it and get it done. There was a reason at the time we didn't make it a recurring requirement every 2, 4, 10 years or something. For these folks, there's no grandfathering in. And some people had spent money to be able to take it the first time. I don't know if there'd be openness to make it a requirement in the bill that it be a free training that they're developing, since they're getting paid to do it anyway, or they're getting a grant to do it anyway.
The training will be offered for free.
The train's free.
Is that in the bill?
It's,
Where in the
Doesn't say
bill?
reoccurring.
Where in the bill does it say it's going to be
well, it
free?
says that it's going to be offered using funding from a grant provided to the Maryland Nurses Association from the ANA.
And then Nathan also read a pretty lengthy explanation. I'm assuming you got that from the Department of Audit. Move favorable as amended.
Second.
There are no amendments on the House bill.
The amendments that you read was already on there. Move favorable.
Yes.
I'll second.
And Senator Giles seconded. Madam, let's call the roll, please.
House Bill 783, favorable. Vice Chair Hayes.
Yes.
Yes. Senator Kramer.
Yes.
Yes. Senator Reedy.
No.
No. Senator Ellis. Yes. Senator Mounts.
No.
No. Senator Jackson.
Yes.
Yes. Senator Washington.
Yes, can I explain my vote?
Yes.
Yeah, and explaining my vote, I really do like this bill. I think it's excellent. I think it's needed in this field, but I also think it's needed in other fields, like our judges in the criminal justice arena, where we've heard earlier today where African American men are sentenced the most out of any other person or people in this state, in the country. So something like this should be replicated for other industries as well. Thank you.
Sounds like a bill for next year, Senator.
I never heard that before.
Senator Guile.
Yes.
Yes. Senator Lamb.
I'd like to explain my vote. So I have no issue with implicit bias training. I think structural racism is real. It's an issue that our licensed healthcare providers need to be aware of. I just think there should be some grandfathering since a lot of them just did this a couple years ago. So my vote is no.
Senator
Senator
Hershey?
Hershey.
No.
No. Madam Chair.
Yes.
Yes. 7-4, bill passes.
And then a motion favorable with amendments conforming the Senate bill to the House bill would be appropriate.
So moved. Seconded by Senator John.
Yeah. Same vote?
Yeah.
Okay, thank you. House Bill 385, Amber.
House Bill 385, as a refresher, is, as amended, requires businesses that use a point-of-sale system that displays a screen prompting a customer to select an amount for a tip to conspicuously display on the same screen or on a previous screen a notice disclosing that the tip is for employees, and on the same screen, a tip amount set at 0 or a no-tip option. The bill does not apply to certain payment transactions included for services provided to customers seated at a table or a bar. The Maryland Department of Labor and the Consumer Protection Division of the Office of the Attorney General must make certain information about these requirements available on its public websites. And a violation of the bill is an unfair, abusive, or deceptive trade practice under the Maryland Consumer Protection Act. You do have a reprint in front of you. It has not changed since this bill was before you, but there was, this bill sponsor did provide some other information on questions that were raised by the committee. So this was just an opportunity to sort of relay that information to the committee about whether this bill is addressing a consumer protection issue or a labor issue. And the indication is that it's basically both. Last year, when the bill was in, the Department of Labor said they could not enforce the screen display requirements, but the Department of Labor already does enforce complaints it receives from workers that are not receiving their tips. So that is still within the Department of Labor. But the sponsor was able to get the Attorney General's Office, the Consumer Protection Division, to agree to be the first line of enforcement. So that's what this bill, how this bill came about. I'm happy to field any other questions or.
Senator Washington?
Yes, thank you, Madam Chair. How does this apply to an earned wage, the earned wage bill that we had yesterday?
It would not apply.
I'm joking.
This is,
Yes.
this is only for transactions at the point of sale. It doesn't apply to like ordering on a mobile device or any goods or services on a mobile device or online.
Senator Hershey?
Yeah, just to go back again to the question that was brought up before on why this is consumer protection. What consumer are we protecting?
So the consumer protection piece is about the tip amount being set at 0 so that there is an option for not having to tip. The Department of Labor employee protection piece is disclosing that the tip is for employees.
So we've got two major agencies involved in an issue because someone was concerned that their tip was not going to the right person.
Yes.
essentially.
That would be what my understanding is,
getting-
and that is something that is already enforced by the Department of Labor. I think also that,
So when there is a concern about where an electronic tip goes, whether it goes to the employee or the business establishment, is that to infer that if a cash tip is provided, that we are assured that that's going to the employee? Or do we know that that goes to the employer? I mean, why are we so focused on one small aspect of tipping, one small mechanism for use for tipping?
For those of us who leave tips, Senator,
That's why I'm confused. I don't know if they're now the service charges that are already embedded in this, but no, I mean, it's the question of, you leave a tip on a credit card, it doesn't say where it goes. You leave a tip in cash, it doesn't say where it goes. And all of a sudden, because we have one new way of making a payment at a counter that has a choice for you, we have to now decide and regulate where the tips are going. We don't do it with any other tips. Amendment, I mean, it goes back to, again, the same thing that we're doing. We have one problem, one person goes and doesn't like the way that something happens, and all of a sudden, we have to come here and make regulations for it. I know, but I mean, it's one after another, and we've already done enough to, hurt businesses, especially restaurants. I just don't understand why this is necessary.
Weren't these amendments offered by the restaurant?
the amendments on the bill and the reprint that you have were requested by the Restaurant Association and addressed their specific concerns. It does not make it removes their opposition, but I wouldn't say they're favorable.
But don't confuse seeing this bill passed twice out of the House of Delegates and being not passed last year, and the Restaurant Association finally saying, oh, expletive, we better do something because this is going to pass this year. So it's not like the Restaurant Association willingly came in and said, hey, this is such a great idea. Can you figure out how we, add these amendments on it? It's like you guys are going to pass a bad bill, and we're trying to protect our members the best way that we can.
Senator Hershey, I will say, after we had this bill last year, I started asking employees in the places where you order at the counter, which is a lot of places now, pizza places, bagel places, you order at the counter, and I'll say, do you see this tip? And every one of them said no. So that's kind of interesting. We're tipping thinking that the employees that help us are getting the tip, and they're telling me they don't see it.
I'm sure you might be tipping for a lot of different reasons, and it might not be the person that's behind the Subway that actually made the sandwich. It might be just because of the establishment, just because of the ambiance, just because of whatever that you like about where you are. There's many reasons for tipping, and there's, Senator Kramer's point, he over tips for everything because that's who he is, but it's because he goes to this great locations and he feels fine about it, where, if that's why you're tipping, that's fine. Nobody asks the question why you tip. It's just being done. It's just, again, another regulation.
Thank you,
we don't
Senator
need.
Mounts.
Thank you, Madam Chair. I want to make sure first, I appreciate the amendments, and there's been a lot of discussion and amending on the bill. But I just want to make sure I understood. This applies now only to, I'm a little, because does it say, is it just food? It's any tipping, right?
Point of sale system.
So
Point
anywhere
of
you're
sale.
paying at a counter at a point of sale system, this is where it would apply to those disclosures. So it could it doesn't have to be a food service
right.
establishment, any goods where they're offering the tip option.
I know, because we were talking about that earn thing the other day, they said tip, and I was like, oh, not that again. But so is tip defined? Like, what is a tip?
Yes, tip means an additional payment voluntarily made by a customer in recognition of service provided to the customer.
Okay. Wait, say it one more time. The tip, where is
It's
that?
on page 2 of your reprint at line 23.
Tip means additional payment voluntarily made by recognition of service provided to the customer. And then I guess kind of where I'm going is I'm wondering how this applies now. So, you know, you go to the grocery store and you pay and you have a prompt. Do you want to give, you know, 10 cents to this cause? You go to the sporting goods store. Do you want to give 20 cents to this cause? I don't, are those are not explicitly cut out and
They would not be included in the definition of tips because you're not giving it for the service, you're giving it to this organization, the charitable organization.
And then consumer protection now for Attorney General, what is they're involved, what is the rationale for putting this now in consumer protection?
The Department of Labor cannot enforce this disclosure requirement at the point of sale system, and the Consumer Protection Division indicated they would be able to.
Right, so why can't the Department of Labor enforce it?
The Department of Labor doesn't do that kind of enforcement. They do already do enforcement based on complaints from employees who are not receiving their tips, and that is within their realm. This would be a complaint from a consumer to the Consumer Protection Division that there is a screen they use that did not have the disclosure is what it would seem to be.
Okay, that answers my questions. And I guess, you know, I'll still be opposed to the bill. I appreciate the changes. I think in addition to it, the policy that was already articulated by Senator Hershey, that, you know, the problems with the policy, but also the real issue here is that tips are protected by law. It's against the law to steal tips. And there's no attention being paid to whether or not that's really what's going on. It seems like the bill is missing the point. There isn't a study, there isn't information by the Department of Labor saying this is a problem. There isn't an indication in where it's a problem and how it's a problem. So I just wanted to share that with everybody to explain why I'll be voting no.
Senator Jackson, this is the last question. We're going to either vote it or move on. Senator
go ahead.
Jackson?
It's
No,
fine.
you're fine. I don't
No,
want to.
it's okay.
All right.
Did you say we could hold it? You said you could move on? Does that mean we could
No,
hold
I
it?
said last question and we'll vote and move on. So we're,
Oh, I thought you said or move on.
I might have, but I changed it.
I'm always paying
If I have a motion favorable, we'll vote it. Do I have a motion favorable on House Bill 385 as amended? Okay. What was next year?
Next, we're moving on to House Bill 482. Which establishes a predetermination review process under which an individual can request specified departments of state government to review the individual's criminal history to determine whether the criminal history would disqualify the individual from obtaining an occupational license or certificate. The bill further requires a department to use existing resources to conduct the review, but also authorizes the department to charge a fee of up to $100 per criminal history review unless the individual's income is at or below 300% of the federal poverty level. You have a reprint in front of you. There are some amendments offered by the chair. First, at page 2, the Department of Health and the Health Occupations Boards are being removed from the bill. So the bill would apply to the Department of Agriculture, the Department of Environment, the Department of Human Services, and the Department of Labor. At page 3 of the bill, in lines 8 through 16, current law language is being restored as requested in multiple people's testimony. And it's not in conflict with the new provisions. Further down on page 3, after line 34, there are some modifications to the language due to concerns around non-lawyers giving what could be considered a legal advisement. So rather than the department advising an individual, they will provide the individual with an explanation for its determination, including the basis of the determination. On page 4, there's some restructuring of the language to make it conform to them being provided with information rather than advice on remedying the situation. So it looks like there's a lot more language being struck than there is. It still allows for a person to ask for a second review if 1 year has passed since they've received the predetermination or there is a material change to the individual's criminal history. And then down at the bottom of the bill in the uncodified language section, Section 2 requires a report on the implementation after 2 years, and Section 3 alters the effective date to July 1, 2025, and sunsets the bill after 3 years. So the idea is the departments would report back on implementation, and the committees and in the House and the Senate would be able to determine whether or not this program is being successful and should be extended or not.
Do we have questions? Senator Lamb?
So when you said that there was an amendment to remove the Department of Health, does this still apply to health occupations?
It will not apply to health occupations due to the removal of the Department of Health from applicability.
Okay, so people, because I noticed in the bill folder, there's a bunch of unfavorable testimony from like every health occupations board here.
Yes,
Okay, all right, so that should address their concerns.
correct.
Okay,
They would be very happy to be out of the bill.
got it, okay.
Senator Reedy?
Thank you. So as I look at this, because I saw some opposition in the other body from one side of the aisle, which I often, I often check on that and usually agree. I'm just be sure I understand this. This is allowing somebody who ostensibly has a criminal record of some kind that wants to get a job in a particular field, but thinks they might be disqualified or isn't sure,
Correct.
to seek there's going to be a process put in place. I assume it's not too expensive to put this process in place. The fiscal note's not some large fiscal note.
There is a note from the Department of Labor on their cost to implement. The other departments do not have fiscal cost to implement.
But it's obviously been signed off on. It's not a $700,000 fiscal note or something, right?
No.
Okay. And all this does is they can find out if they're able to, if they're going to be disqualified or not from applying.
Correct. So the idea behind the bill is, say someone wants to go to nursing school, or not nursing, sorry, bad example. Say someone wants to become an electrician.
Right.
And they haven't gone through an apprenticeship or training yet. They can get the predetermination to see if their criminal history is going to disqualify them.
Before they
So
pay to do a bunch of this
Precisely.
stuff. And that's all the bill does, as amended. And it says something about 7 years of sex offender
That is
registry.
already in current law. That's if 7 years or more have passed since an applicant has completed the sentence, that criminal history can't be considered unless it's a crime for which there's a sex offender registry required.
But if you have a criminal record even from 15 years ago of an armed robbery, you're going to be disqualified, right? This isn't giving anybody any rights they don't already have under the law.
Correct.
It's just letting them find out if they indeed can.
Whether they'd be disqualified or not.
Senator Ellis?
Amber, you mentioned something about 7 years. If 7 years have passed, could you review that again? Please?
Sure, so that's what's in current law. The bill, as it was introduced, struck this language. But currently, for the licensing boards, if a period of 7 years or more has passed since an applicant completed serving the sentence for a crime, including any supervision, probation, parole, and they have not been charged with a new crime other than minor traffic, the department may not deny a license or certificate to the applicant solely on the basis of that crime. So if 7 years have passed, you can't be denied solely on that conviction.
7 years.
But that's current law.
That's current
The
law.
bill is not changing that anymore. It's
Okay.
been restored.
So in response to Senator Reedy's question, you mentioned something about they still can be disqualified?
If that is not the sole basis. But it's not changing current law and how the licensing
Yeah.
works currently.
Yeah, I know. I looked into certain areas, and like, for instance, liquor license. Certain individuals with felony convictions can't even get a liquor license. Will this bill covers that, or is this
The
basically
bill would not
occupational?
address, would not alter the alcoholic beverage licensing process.
That's occupational, okay. Thank you.
Okay. No more, Senator Lamb.
Question. I just wanted to make sure this was clear here. So I think the bill, as it came over, said it removed, so in existing statute, there was a provision that said 7 years or greater, they would not look at that.
They
No,
can,
that's existing statute.
Yes.
The way it came over struck that, and now we're amending to unstrike that, which is the strike through on the brackets, right? So we're
Yes.
going to retain current law on that, just to.
we're going to restore, the amendment restores current law. There was many pieces of testimony that requested that be
Yeah,
restored.
that makes sense. Okay, thanks.
All right, I don't see any other questions. Motion favorable?
Yep.
Senator Hayes?
As amended.
As amended. Motion favorable. Do I have a second? Senator Reed? All in favor of, do I need to call roll? We all in favor? Okay, all in favor of House Bill 482, unanimous vote. Worked it out. As amended. Okay, last bill? Is this the last bill?
The last one on the front page, we still have Mr. Smolsky's.
Mine will go quick.
So this is House Bill 956 that we discussed yesterday, establishes the work group on artificial intelligence implementation to monitor issues and make recommendations related to AI. I believe that bill was held by Senator Washington, so I'm just see if his concerns have been addressed, or if he has any follow-up questions.
Thank you, Madam Chair. You know, I heard this bill was, or now the amendments made it fair and balanced like Fox News, so I'm all for it.
Thank you, Senator Washington.
Very balanced. You know how to take that. I don't see any questions. Can I have a motion? Motion favorable on House Bill 956 as amended?
Move favorable.
Second. Senator Hershey? Okay, Senator Hayes, Senator Hershey, all in favor of House Bill 956 as amended? Thank you very much.
Okay, flip your page, and you also have a blue page on your desk. You have a motion to recede from the Senate amendments on House Bill 970. Apparently, the House did not buy Dr. Lamb's argument that insulin or insulin analogs are inexpensive, or not that expensive. They believe they're very expensive, so they are asking you to refuse to concur to the Senate amendments on the health insurance insulin prohibition on step therapy bill. Yeah. Okay. Move to not move to not recede from the Senate amendments. That's the motion.
Do you want to, did Senator Lamb want to respond at all, or?
Do we need to appoint a?
Yes, if you wish to.
mean, nobody cares.
Conferees, yes. We can get them later.
All right, we'll get conferees later. Senator Lamb, I'm sure you're going to want to be a conferee.
Maybe the
Great.
chair.
Okay. All right, now we're going to go to David's three bills on the back.
Okay, the first bill on the list is House Bill 346. This is a local Baltimore City alcohol bill that is the same as Senate Bill 788, which passed the Senate. In the 43rd District, it authorizes several licenses and is supported by the Baltimore City Senate delegation. It's favorable.
Favorable. It's a local bill. Everybody in favor, House Bill 346? Thank you. House Bill 813.
House Bill 813 is, as introduced, it did a lot of things, but the House amended it and sent it over here as a work group. The work group requires the Maryland Insurance Administration and the Maryland Department of Health to convene a work group of interested stakeholders and third-party experts in the field of drug pricing and Medicaid. The work group must review reimbursement for pharmacists, coverage requirements for specialty drugs, and exemptions for pharmacy benefit managers regulation over ERISA. You have a reprint in front of you. The chair is offering some amendments which if you go to the last couple pages of the reprint, you'll see what they are. They add a few more folks to the work group, or a few more groups to the work group, including health insurance carriers, plan sponsor reps, drug wholesalers and distributors, non-pharmacy benefit managers, owned mail order pharmacies, brand name and generic drug manufacturers. And so these folks would be added to the work group. And then if you go to the next page, there's an additional responsibility or duty added to the work group, and that would include reviewing the costs associated with pharmacies contracting with commercial plans versus pharmacies contracting with the Medicaid program. And then there's an additional change here that concerns the sections 15-1611.1 of the insurance article and 15-1612 of the insurance article. These are the provisions that govern PBMs in the state. And what this does is require them to also look at to review provisions of state law regarding pharmacy benefit managers, specialty pharmacies, and anti-steering, including the sections I just mentioned related to the use of specific pharmacies or entities and the effect of the section has on pharmacy costs in the fully insured market. And again, the other section would be related to reimbursement of pharmacies and the effect the section has on pharmacy costs in the fully insured market. Because right now, these provisions apply only to the fully insured market. And you have another bill, which we just got amendments on, which you may be seeing tomorrow, which deal with with the ERISA plans and the laws governing PBMs in the state. But this would add these individual items to the study, and the Insurance Administration said they were going to look at these items anyway.
So this has the blessing of Commissioner Grant.
Well, at least those two items. I don't know about the other item, but
Who's studying all this?
the Insurance Administration, oh, there's also an additional change I forgot to mention. The Insurance Administration, along with the Health Department, and in consultation with the PDAB.
Maybe we'll finally get some answers about PBMs, huh?
Quick question. When, in the bill that talks about the study, it says how it works in other, how PBMs work in other states, including Ohio, Kentucky, New York, California, West Virginia. Any reason why it was those states?
I don't know. I could check with the House on why they included it. Maybe that they have similar laws on the books relating to these things?
At some point in time.
Okay, I'll check.
If you don't mind. If you don't mind. Thank you.
Seeing no other questions, can I have a motion favorable? I'm sorry, who motioned? Senator Lamb motioned? And Senator Hershey seconded. All in favor of this House Bill 813? Unanimous vote, thank you. David,
Okay.
thank you. I know that was a lot of work. I appreciate it.
Okay, and the last bill on the list in for today is House Bill 1502. This concerns the Baltimore City AIDS Prevention Sterile Needle and Syringe Exchange Pilot Program. This program only exists in the city, and it's been around since 1994. So the city has come in with a series of changes to the law. One, to take out the word pilot, since I don't think they have any plans on it going away. And it also updates a lot of the language going from AIDS to HIV and makes other changes more in line with how things are today than they were in 1994 when it was first adopted. The bill has a letter, we have a letter from the Baltimore City Senate delegation approving the bill with no amendments.
Mr. Vice Chair?
Madam Chair, as many of you all know, the Baltimore City Health Department is the oldest health department in the nation. There was no other health department when the Baltimore City Health Department was established. They're always on the forefront of good public health. I move this bill favorable.
I have a motion favorable. Do I have a second? Senator Ellis. All in favor of House Bill 1502 with no amendments?
With no amendments.
No amendments, just favorable. Do we need to call the roll?
Yeah.
Okay, can we call the roll?
Needle exchange, yeah.
House Bill 1502 favorable. Vice Chair Hayes? Yes.
Yes.
Senator Kramer?
Yes.
Yes. Senator Reedy? No. Senator Ellis?
Yes.
Yes. Senator Mounts? No.
Why
Senator
don't the
Jackson?
Republicans want aid protection?
Yes. Senator Washington? Yes. Yes. Senator Guile?
Enthusiastically, yes.
Yes. Senator Lamb?
Yeah. I'm curious.
Senator Lamb? Yes. Yes. Senator Hershey? No, Madam Chair?
Yes.
Yes.
About a one-to-one deal.
8-3, the bill passes.
Let's see.